Good morning, everyone. Very warm welcome to all the participants joining us today for the webinar organized by the National Medical Teachers Association India. I am Dr. Rohan and I will be moderating today's session. We are delighted to host this important discussion on biomedical waste management, a topic that plays a vital role in ensuring safety, sustainability, and regulatory compliance in healthcare setting. It is my pleasure to introduce our today Dr. Pragnesh J. He is a distinguished academician and seasoned microbiologist, currently serving as associate professor in Department of Microbiology at SMIMER Surat. With over 25 years of teaching and academic experience, Sir has significantly contributed to both undergraduate and postgraduate medical education. He has done his graduation in medical microbiology from M.Sc. Medical College, Jamnagar, and Ph.D. from Government Medical College, Baroda. Active researcher with many publications in reputed journals, he also plays a pivotal role in academic governance, public speaking, and organizing workshops and symposiums. With a calm demeanor and tireless dedication, he is not only a respected academician, but also a beloved guide amongst its students. Now, before we begin this webinar, a few quick announcements to be made are please drop your questions in the chat box. We them during the question and answer segment at the end. And this webinar is also being recorded and the video will be uploaded to our YouTube channel soon. With this, I invite Dr. Pragnesh J to begin with his presentation. Over to you, sir.
Everybody who are present here to learn about biomedical waste management. So before we begin our today's lecture, let me give my homage and give my uh, special thanks to Dr. Anupama Desai, who is Professor and Head of Pharmacology Department at SMIMER Medical College, Surat. She is also a National Medical Teacher Association Organizing Secretary. I also thank Arvind Singh Panwar, who is Professor of Pharmacology, SMIMER Surat. He is also NMTA founder and coordinator. I also thank Dr. Kurte, Dr. Zil R2, Dr. Rohan R1, Dr. Rakesh R1, and Dr. Harsh R1 with preparation of presentation. Now let us our today's presentation, and I start our management. For that, I would like to say that you should learn to do namaste. Okay. So with the namaste, we again go back to biomedical waste management. Okay. Okay. We should check that biomedical waste. What is the category? There are 10 categories, different types. Item required for disposal of biomedical waste, handling, storage, recording, and keeping of for biomedical waste, treatment, destruction, and disposal of biomedical waste. And at the end, we will see the do's and don'ts for biomedical waste. So, as far as the biomedical waste management is concerned, they were established by Ministry of Environment and Forest. It was in 19. So, as per the in 2011, 2016, 2018, 19, 20, and 25, the rules are framed. But basic rules are moreover covered in 2016 BMW guideline. As far as the definition of biomedical waste is concerned, it was in 1998 by Ministry of Environment and Forest, as we said in previous slides. It was done on 28 July 1998, where the amendment was made in the any waste which is generated during the diagnosis, treatment, or immunization of human being or animal. So it is not only concerned to it is also concerned to veterinary science in research activities product categories mentioned in the schedule 1 of the of biomedical. So this is how the biomedical waste is being established. So before the biomedical rules were established, we know that we can go to the seashore and but if the biomedical rules were not, the biomedical waste have been thrown in the seashore and have been beaten by syringes and needles when we go to seashore. That is healthcare waste defined as the healthcare waste are all the waste from medical institutions, that is public or private, a medical research facility or a laboratory. That's coming to healthcare waste. This healthcare waste is only 6% waste, which is probably infectious or toxicological waste, but 85% waste, do remember that 85% is non-hazard. That waste can be to the disposal. Only 50% waste, out of which 10% is infectious, 5% can be carcinogenic or hazardous or toxicogenic. Biomedical waste, as per biomedical waste rules, we have to manage that waste. But do remember that we mix infectious waste to the non-infectious waste. Suppose if we mix infectious waste with non-hazardous waste, then our 95% is infection. So that is burden, financial burden on the hospital to the waste, because the waste is given to the biomedical waste management. So that will ultimately manage the waste. Participant waste is chemical or radiological waste that is covered. So overall it becomes 100 waste, 85% non-hazardous, 10% infectious, 5% chemical and radiological waste. If you want to increase volume from this, no? Fine. Okay. So coming to the hazard associated with the biomedical waste, the hazard from waste that is pathogen in infectious waste can give rise infection to the healthcare worker. For if suppose if somebody is beaten by a syringe or needle, probably blood viruses can transmit the infection to the individual. So sharp waste has to be handled carefully. Otherwise, person who is handling the sharp waste can get infection. Probably bloodborne viruses and other infections can be there. From the chemical waste like toxic or corrosive waste that can cause disease or chemical burns can happen to us. It is exposure. Several somebody want to throw the expired medicine, and if that medicine is being consumed by some animal, and it is of law for or something like that, send it. Can also come like it is a mutagenic, teratogenic, or carcinogenic waste. Hazard from radioactive waste, that is genotoxic waste or tissue destruction waste. So ultimately, when we are managing the waste, we have to remember 3R. It is reduce, recycle, and recover the waste. So coming to this, we should understand the waste segregation policy, because biomedical waste is generated usually by hospitals, research activities, vaccine centers, and laboratories. Now, individual thing should remember to segregate them. So separation of waste is very important on their part. So according to BMW Rule 2016 in the Gazette, the segregation formula is given. There are 4 different colors of bags that are used. That is yellow, red, blue, and white color bags are used. A part of these 4 bags, one bag that is black to be used, but that is for municipal uh, waste disposal site. So that is non-infectious waste, non-hazardous waste can be thrown in black color bag. So municipality can throw that waste. Other 4 bags, that is yellow, red, blue, and white bags, will be thrown according to the biomedical waste management guideline, even in 2016. So steps of biomedical waste management is like waste is into color code container. We have to separate the waste. Pre-treatment of laboratory waste. Suppose if we are doing the sputum, suppose if we are throwing the blood sample. So before throwing the sample, we have to do the pre-treat. Like blood samples are added in 1% sodium hypochlorite solution for at least an hour. Thereafter, the bottle blood is being taken away from the container. The bottle of blood is being thrown. The blood which is separated out in a bucket is being thrown in the biomedical waste management, like wash basin or something like that. So blood is being exposed to 1% sodium hypochlorite and thereafter thrown in a wash basin, and the bottles are after exposure to 1% sodium hypochlorite separated and thrown into biomedical waste management as per biomedical waste management guidelines. Because these bottles are made up of glass, it can be thrown in quite easily. So transport or battle zone should also be carried. Suppose if a hospital is generating the waste, there should be a central storage area, everywhere color code waste bags. So in that central area, these bags are being stored and from there it is transported to the biomedical waste management site. The common biomedical facility CDMWTF area. It is not in a hospital. It is away from the hospital, apart from the hospital. So the in hospital and the waste from the hospital and be taken up to the CDMWTF, and for that the vehicles are required, and these vehicles will transport this biomedical waste to CDMWTF facility area, where it will be treated. Final disposal will be done at CDMWTF area. So that disposal should be done within 48 hours from the waste generation site. So suppose if waste is generated in hospital, waste is taken up to the waste treatment facility, treated and disposed of, that time should not be more than 48. Now we come to the segregation of biomedical waste, more important, and that was the rule, medical waste management rule India 2016, including the amendments added in 2018 and 19, updated in this. So according to this, biomedical waste, it is no plastic waste, that is plastic. Just a minute. Much is the volume of
Hello. 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 I think now I'm audible to everybody. Okay. So the first thing is we have to have a yellow color container, that is foot operated container, who is having a lid top, and this container should be thrown with infectious non-plastic waste. So whichever the waste is there, that is not made up of plastic, but it is infectious waste, that we should throw in yellow bag. The reason is yellow bag will then be incinerated. So incineration will burn the waste and turn into ashes. So if we are burning the plastic, that will create a lot of smoke and pollution will be done. So to avoid that pollution, we can throw the non-plastic infectious waste into the yellow bag. Now, first thing is chemical solids, like those which are made up of powder or crystals, etc. These chemical solids can be thrown in this yellow bag, and these yellow bag will be non-chlorinated plastic bags. And then after this yellow bag will be incinerated, that is burning at somewhere around 850 degree to 1250 degree centigrade temperature. or it will go for plasma pyrolysis that will be more than 5000 degrees centigrade temperature or encapsulation. Second thing is chemical liquids. Now we cannot throw chemical liquid into this yellow bag. So such as like disinfectant, body fluids, secretions, housekeeping related activity liquids. These all chemical liquids can be discharged into a separate collection system which leads to an affluent treatment system. So we cannot throw it in a yellow bag. We can throw it in, suppose if wash basin or in other discharge containers. But before that, it can be pre-treated by mixing with other waste water. We can also throw discarded linen. That is, if the patient is lying on a bed, the linen of the bed can be thrown in the yellow bag. We can also throw the blood, body fluids, mask, caps, gown, shoe covers, etc. in this yellow bag. This yellow bag can then be, it is a non-chlorinated chemical disinfectants can be added into it, yellow bag, and then the incineration or plasma pyrolysis can be done. We should not use chlorine because while we are doing incineration or plasma pyrolysis, this chlorine will inhibit. So non-chlorinated chemical disinfections can be used to discard this linen and other contaminants in yellow bags. Other waste is microbiological waste, that is infectious waste, clinical laboratory waste, blood bags, live attenuated vaccines, live or attenuated, autoclave. This can be autoclaved before we finally treat the things. So after autoclaving in a safe plastic bag, we can go ahead with the pre-treat to sterilize with non-chlorinated chemicals. Again, we cannot use chlorinated chemicals. This is as per the guideline of NACO and WHO, and then we can go ahead with incineration process. So we have to add non-chlorinated chemicals and then incinerations can be done. The another color bag is a red color bag. In this color bag, we can infectious plastic waste, because the infectious waste can be of two types, plastic and non-plastic. We know non-plastic is added in yellow bag, but what to do with the plastic infectious waste like tubings, bottles, intravenous tubes, catheters, urine bags, syringes and needle, fixed needle, vacutainer, gloves, plastic apron, goggles. Nowadays we are wearing that also. So everything which is made up of plastic but infectious has to be added into this red color bag. Now this red color bag is also non-chlorinated plastic bag container, but this cannot be incinerated bag because it contains plastic. So we cannot incinerate this. So we have to do autoclaving or microwaving for this, because if it is having plastic and if we incinerate, then a black smoke will be created. So a lot of pollution will go ahead. So to avoid that, we have to do autoclaving or microwaving. We can also do hydroclaving and shredding. We can do mutilation, sterilization, shredding, and we can also treat the waste sent to authorized recycler for energy recovery. But ultimately, autoclaving is enough for this. Then comes the white or translucent sharp cutting material. That will be a non-plastic, what we can say, that will be a container. It cannot be a bag, because otherwise the sharp will it will destroy the bag and it will come out and it will hurt somebody. So a proper container should be there so that metal sharps cannot come out of this. Now this white color container is used to discard needles, syringe with fixed needle, needles from the needle tip cutter, burner, scalpels, blades, or any other contaminated sharps that we can throw in this white color container, that is puncture proof container. So all this thing is added in this. This is a puncture proof, leak proof, temperature proof, a white color container. This goes to the biomedical waste treatment site where it will be autoclaved, or it can undergo dry heat, shredding or mutilation, encapsulation in metal container, or cement concrete discarding can be done. Sanitary landfill can also be done, or designated concrete waste sharp pit is also available in which we can through this white container. We will see all these things when we see disposal of all these containers. Then comes a blue color container. Now this is nowadays used to recycle the metal. So glassware or metallic body implants, suppose if this container is specially required in orthopedic OT or any other area where the body implants are being surgically removed. Suppose if somebody is given total knee replacement, so the surgical removal of total knee implant can be taken out, and that implant we have to put in blue color bag. So this is a cardboard or box with the blue color marking. This goes for disinfection, glass waste cleaning. If the glassware is there, glass waste cleaning by the detergent or sodium hypochlorite treatment. Though autoclaving, microwaving or hydroclaving with recycling, if it can be done, then the chloride container disinfectant should be prevented. Otherwise, what happens? This metal part goes to the recycling unit where the metal will be recycled and it will given again to the manufacturer for manufacturing new implant. Before we discard the waste, we should have these two what we can say biomedical waste symbols, like biohazard symbol or cytotoxic hazard symbol. We should remember. We should paste this symbol on the, as we can see here, the biohazard symbol is being pasted on the all these white or blue or red or yellow containers. So this we should stick on the container. If it is a cytotoxic waste, as I said, the medicine is being thrown. So only the medicine is there, then the yellow bag should have cytotoxic hazard symbol on that. So these are two symbols we should remember, biohazard symbol and cytotoxic hazard symbol. We should have a different color coded bags, and these bags, according to the biomedical waste discarding rules, should have this either of the two symbols on that. Now coming to final the color code of the bag. One is yellow color, that will have category 1, 2, 3 and 6 discarding waste. It will go for incineration at the biomedical waste disposal site or deep burial of ashes after incineration can be done. If it is a red color bag, we have to remember the disinfected container plastic bags category 3, 6 and 7. We will see all this category also, what happened, what comes under category 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We will see that. But this category goes in red color bag. And then red color bag at the biomedical waste disposal site goes for autoclaving and shredding. So the red color bag will be autoclaved, and after autoclaving, the shredding will be done. And this shredded, the small fragments will then be go for deep burial in landfill. It can be blue color or white color bag, which is a sharp bag, which is a puncture proof bag that contains category 4 and 7 category of waste that will go for autoclaving and shredding. And small balls can be prepared from the metal or the glass that can be used go for reusing of the material. And of course, one more bag I've added, that is black color bag, that is non-hazardous waste that we can give to municipal secured landfilling. So we can put the black bag in the municipal municipal waste disposal site container. So black color means totally non-hazardous waste. Every hospital will have maximum non-hazardous waste. We have understood it is 85% of the waste which is non-hazardous will go in black bag, like the material comes from the kitchen or the box of the medicines, the bag, the plastic bag on the medicines. This everything, plastic bag on the kits, plastic bag on the vaccines. This all goes in a black bag because it is totally non-hazardous. And then we can go for the wastage of black bag in municipal garbage. So many areas in a hospital which will generate the waste, like outpatient area, which will generate the solid waste like gauze, bandages, plastic solid waste, sharp waste that will be covered in outpatient area. Injection room, every hospital has, that will cover the solid waste like sharps and solid waste. General ward, every hospital has, will cover the sharp waste. Solid waste and soiled waste will also be generated over there. Operation theater, like body parts, human anatomical waste, sharp waste, solid waste, soiled waste, everything will be generated in operation theater. Intensive care unit will generate the sharp waste, solid and soiled waste. Casualty and emergency will generate the sharp, soiled and solid waste. Laboratory will generate the sharp, solid, soiled and biological waste like culture media, etc. And pharmacy will generate the discarded medicines, the cytotoxic medicine, carcinogenic medicine, etc. And that will also have an effect of biomedical waste. So before we go ahead, we should learn different category of biomedical waste management. There are 10 categories given in 2016 guideline. So the first thing was Ministry of Environmental and Forest that created a conference in 1998, probably that was in Baroda, and which had classified the waste into different 10 categories. So this is the segregation of waste principle, that all waste is divided into 10 categories. As per the color code of the container, the categories will go. We had seen which color code should have which category, that we had already seen. So 5 color coded containers are there. We had seen the yellow, red, white, blue, and definitely the black one for non-hazardous waste that we had seen. So in this container, 10 different category of waste should go. So these rules were created in 1998 that were being regenerated in 2016, 2018, 19 and 2000. Probably some regulation came in 2025 as well. So according to that, we will see different category of 10 category of biomedical waste. So category 1 waste is human anatomical waste. When somebody undergoes operation, probably some part of the body will be taken out in the OT, and that will becomes, suppose if the part is being taken up over here, so that becomes the human anatomical part. Suppose if animal research activity is going on, then suppose if the animal is no more, then the animal waste will be created. It will be category 2, as we can see here. Category 3 is micro and biotech waste, which is infectious waste. It may have different bacteria on it. Category 4 is sharp waste. So that is very sharp, like needles, syringe, scalp blade, etc. etc. Category 5 is discarded medicines, as we can see over here, category 5 waste. This medicine can be carcinogenic, toxic medicine, normal vitamin medicine, etc. can be there. Soiled waste can also be there, like that may have the cotton, garbages, bandages, etc. That is a soiled waste. Category 7 is a solid waste that is being generated over here, but it is mainly made up of plastic, as we can see. Containers are there, the catheters are there, etc. all made up of plastics. Intravenous catheter is there, urine catheter is there, IVP shunt is there, the pint is there, IV line is there. So all this made up of plastic is under solid waste, that is under category 7. Category 8 has a liquid waste. So this liquid waste will usually go to the hospital sink and then will be discarded. Category 9 is incineration ash. Suppose if yellow bag goes to the biomedical waste management site, where it will be incinerated in a machine, and after the incineration, the ash is created. This ash is category 9 waste that will go with deep burial procedure at municipal waste disposal site. And category 10 is a chemical waste, as it is being shown over here. This chemical waste will also be thrown after treatment into hospital waste hole, or maybe the wash basin or sink. So these were the different category of waste, 1 to 10 category. We should remember this category. So ultimately we know we have identified all these different categories. So now we will eliminate the waste. How to eliminate the biomedical waste? So item requires for the disposal of biomedical waste is, we need the glasses, we need mask, we need boots, we need aprons, we need cap, we need gloves. biomedical waste discarding symbols. So these are the items that is required before we discard the biomedical waste. Further, we also need a yellow container, red container, blue container, white container, black container. We also need blue bag, red bag, yellow bag before we discard the waste. We also need a black bag as well. Further, we can also have a needle burner cutter, needle syringe cutter with a burner. We can also have a needle cutter if it is not there. We can have a scissor and disinfectant solution so that we can put this disinfectant solution in different samples like sputum or other samples that we have to added with 5% sodium hypochlorite solution. We have to keep for half an hour, and then after we can throw it in biomedical waste management container. We should have a weighing machine. We should also have a dedicated trolleys to tackle these different containers, yellow, red, white, etc. Definitely, we should have a temporary central storage room where we can store different category of waste. But do remember, this red color bag does not show any yellow bag in it. So we should have a different separate area in a temporary central storage room. In one area, we should have red color bag. In another area, we should have yellow color, white color, and blue color bags in different separate areas we should keep. We cannot keep all the bags together. Naturally, we have to keep all the bags as per their color code system. Then, which are the items required at the biomedical waste generation site? The deep burial, so a deep pit is required. Now, this deep pit will be added with incinerated ash or probably other discarding materials, etc. that we will see. Then there should be a sharp pit. So this is a very deep pit. This is having a secured cementing landfill, and there is a 4-inch pipe at the top. Now this will be added with the sharp container. So sharp will be kept in a bottle that is 4-inch or lesser. So this bottle we should put in this pipe, so it goes inside the sharp pit, something like that. Secured landfill, so it is a big area that is under the land in which we can do proper landfilling. This area is also cemented, and it should also have a cover. What we can have, it will have a covering on its top. Naturally, most important thing is transport vehicle we required for the biomedical waste transportation from hospital to CBW MTF area, that is biomedical waste discarding area. Up to that, we should transfer the biomedical waste in these vehicles. Naturally, we also need autoclave, incinerator, and shredder at the site of biomedical waste discarding. Further, we should have water waste treatment plants in biomedical waste discarding. So the dirty water can be given to this, and then the dirty water can be treated, and then after it can be thrown properly. Now we will see what is handling, storage, and record keeping for biomedical waste. Whatever the waste we fill in the bag, the bag should be filled up to 3/4 level. It should not be filled up to top. After 3/4 level, if it is filled, then we should have the neck of bag tied, because we cannot tie the neck of bag if it is fully filled. So only 3/4 filling is required, and then we can tie the neck of bag. Thereafter, the movement of waste should be monitored. So from the bag where it is tied to the storage area, it will go into the hospital, and we should have a monitoring system, probably through CCTV or other system, through which we can monitor. Trolleys cleaned daily and not used for any other purpose. Trolleys of biomedical waste discarding should be cleaned daily, and these trolleys should not be used for any other purposes. Inside the hospital premises, we should have a storage area. In a central storage place, there should be a good lighting, at least passive ventilation, protected from the sunlight and vectors. Most important, mice and other vectors should not go there. Otherwise, they will flourish over there and they will do a lot of headache for us. So there should not be any vector presence over there. Sunlight should also be light. Adequate cleaning facilities should be there in the central storage area, and that area should have easy access for waste collection vehicle as well. The central storage area should not be at the place where the waste collection vehicle cannot reach. So it should be near to the road where the waste collection vehicle can reach very easily. So suppose if the central storage area looks like this, where all the red bags we can see, likewise the yellow bag, white bag, blue bag area should be there. We should also have a record keeping for biomedical waste. We should complete record for all aspects of the program. We should access the expenditure, and we should do the waste minimization effort. Whatever the biomedical waste is generated, it's only 15%. We should try to reduce that also in our hospital. The written waste management policy of the hospital should be notified to all the staff members of the hospital. Naturally, as I said, suppose if somebody mix 15% of waste with 85% which is non-infectious, then 100% waste becomes infectious. And it is very difficult to manage that waste properly, because if the 100% waste is infectious, then it costs us more. Treatment, destruction and disposal of biomedical waste. Now we will see how we discard all different category of waste. So now see, suppose this is category 1 waste. This is a human anatomical waste. Now this waste is generated. The human anatomical waste is kept in yellow bag, as we know. Then the yellow bag is kept at the central storage place of the hospital. Then it goes to a vehicle from where it reaches to the biomedical waste management area. In the biomedical waste management area, it will undergo incineration process. So incineration will be done. So thereafter we can have the ashes. These ashes will undergo deep pit burial by municipality at biomedical waste storage area. So that's how the category 1 waste is discarded. The waste is transported to the area where it is incinerated, and ash is deep burial by municipal people. Same way happens to the category 2 waste, that is animal waste, that is also being generated in a research facilities. So these animals are kept in yellow bag. Yellow bag is stored at central storage area. Then it is being taken up by the vehicle to the discarding area, where it is being incinerated, and the ash generated after incineration, after burning 850 degree to 1250 degree centigrade over here, this ash is being deep buried into the secured landfill of municipality. Category 3 waste is a soiled waste, like linens, microbiological waste, etc. So this is an infectious waste which is made up of plastic. So it is being thrown in red color bin. It is kept at the central storage area. Then it is being taken up by the vehicle to the biomedical waste management site, where it will be autoclaved. It will not be incinerated because it contains plastic. So it is a red color bag. So it will be autoclaved. It will not be incinerated. Yellow bags will be incinerated. Red bag will be autoclaved. After autoclaving is over, the shredding will be done. This red color bag will undergo shredding process. Small pieces of red bag will be done, and it will go to the municipal secured landfill. So this landfill is having a concrete ceiling, and the top will be open, and this the shredded material will be thrown into this. Because it is made up of plastic, its discarding will need a lot of time. So this will be kept in this shredded material. Now the next category is made up of sharp. So plus metal sharp or glass sharp will be there. So all these syringes and needle will be cut by syringe needle cutter, and then in 1% sodium hypochlorite solution, this needle will be kept for at least 10 minutes. Thereafter it will be thrown. So it's a category 4 waste, the waste sharp. So this sharp waste is generated. Its mutilation will be done. Its disinfection with 1% sodium hypochlorite is done. Then it is kept at the central storage area in a hospital. Then it is being taken up to the biomedical waste management site. In the biological waste management site, there is a sharp pit. So we can put all this sharp under the sharp pit, which is securely having a concrete ceiling all over the area. In this, we can put this sharp pit. Or else, if we cannot do it, we can put this in a metal recycler area, because these are all metals. So it is disinfected and then came to the site. So it will go to metal recycler area where it will be properly recycled, and small pieces of metal, small balls of metal will be created, and that will again go to the manufacturer for metal recycling. Suppose if we are not using the white container, we have a blue container that will have glass or the metal, joints metal or the other metals that is being implanted in us. Suppose if this is the blood bottle, so these blood bottles will undergo 1% or 5% sodium hypochlorite. This blood we will put in 5% sodium hypochlorite solution. Thereafter, the bottles are separated in half an hour. The bottles are then put in blue container. Then it will go to the glass recycler factory at the site, where the glass will burn and turn into small balls. And these small balls of the glass will be given to the recycler, will again recycle it, and we can use it. So at the secured landfill site, we can have a sharp pits for disposal of sharp waste, like all side of pits that is plastered and concreted. Cylindrical metal pipes of 4-inch can be at the top of the pit. Opening of the metal pipe by locking facilities should be there. Sharps are disposed into the pit with using the pipe, and puncture-proof translucent containers are kept in this. This will mutilated and sealed completely when the sharp pit is completely filled. Thereafter, it is being packed. So say this is the sharp pit that is having concrete ceiling all over and 4-inch pipe at the top. So from this we can put the container as you can see here inside this sharp pit. So this container will go into the sharp pit, and this concrete container will completely have the sharps in this. When it is being filled properly, when the sharp is filled in this container properly, thereafter we can do the sealing of the container, and it will be kept for more period of time. Category 5 is discarded drugs or medicines. So these discarded drugs or medicine, we can put it in yellow bag, and then it will go to the biomedical waste disposal site by a container, by a transport vehicle. And here it is thrown in municipal secured landfill site, or probably it will underwent incineration. So it will be burned properly, and after the incineration, the ashes will be thrown in secured landfill slide. Category 6 is a solid soiled waste that may have a gas piece or may have the cotton, something which is filled with infectious material. It is being thrown in a yellow bag. Yellow bag is kept at the central storage area of the hospital. It is being taken up by the CBMWTF to the site for discarding. Here it will underwent incineration, and after incineration, the ashes will be deep buried. Category 7, as you can see here, is a solid waste. Like all this waste, as you can see, the plastic containers, catheters, etc., is a solid waste that is being mutilated first. So we have to cut the containers and the catheters, and then we can throw it in a red bag. Then the red bag goes to the central storage area, from where it is taken to the biomedical waste disposal site, from where it will undergo autoclaving process. And once the autoclaving is over, the plastic recycler company will be there that will prepare a small ball of plastics. This small ball will again go to the manufacturer, and they can reuse the plastic. Category 8 waste is the liquid waste. As we can see here, the liquid waste can be wiped off directly, or maybe some effluent treatment plant is there, then the liquid can be given to that plant, and then the discarded into the drains. After that, liquid waste can be discarded into drains. Category 9 waste is incinerator ash. Once we complete the incineration process, whatever is burned, is turned into these ashes. These ashes, we can put it in a black bin, and then it goes to the municipal secured landfill site, in which this ash will be landfilled. Category 10 is a chemical waste, that is solid chemical, not a liquid chemical. Liquid chemical usually goes into a sink, but solid chemical can go to the black bag, then central storage area, then coming to the biomedical waste management site, and municipal secured landfill will hold the powder or crystal of the chemicals, and then it can be stored. So this is how we have completed the different 10 category of biomedical waste, how we secure it, how we throw it, how it is being processed as the biomedical waste disposal site, that we have seen. Now, treatment and disposal technologies in healthcare waste, that has chemical disinfection, autoclave, incineration, hydroclave, microwave irradiation, and land disposal, that should be available to manage the biomedical waste. Now let us understand some do's and don'ts for biomedical waste management. So universal safety precaution ones we have to observe. Suppose if we are handling the biomedical waste, naturally it will be an infectious waste, chemical waste, cytotoxic waste. So naturally we have to wear PPE, personal protective equipments like gloves, apron, goggles, mask, cap, shoe, etc. should be properly. We have to take out precaution for all these things, and then we have to handle the waste. Segregate waste as soon as it is generated into a specific categories of waste. Somebody is generating the waste and throwing the waste on the floor and say my class 4 will come and will segregate the waste. So it's a bad habit. Once you generate the waste, after generation of the waste, immediately throw the waste into a different color code system. So everywhere you should have a different color code container in which you have to throw that waste. Suppose if you are working in OT, you cannot throw somebody's anatomical part on the floor and your class 4 to come after the OT is over and throw it in a yellow container. No. Once you take out the part, you have to throw it in yellow container itself. Or if you can put it in a tray, you can show it to the patient and thereafter you throw in yellow container. But as soon as the work is over, it has to be thrown in its proper container area, color code system, it should go. Collect the waste in a specific color coded covered bins in a biohazard label. So all colored bins should have a biohazard label. What is the symbol? It is given over here on the top. We have already seen it. So that should be there. Destroy needles by using needle cutter and needle burner. That is, once you cut the syringes and put the needle in needle burner, while burning the needle, it can create some splashes. So you should cover that, or else you can put the needle into a container directly. After naturally chemical disinfection, you can put the needle in white container. Multiple plastic waste like solid waste, as soon as it is generated, it should be thrown. All liquid chemical waste drain out to and after chemical treatment should be thrown properly. Never mix infectious to a non-infectious waste. Do remember, non-infectious waste is a large part of a hospital. 85% waste generated in a hospital is non-infectious. So we should never mix infectious waste into it. Otherwise, the all waste becomes infectious, and we have to 100% throw the waste as infectious waste itself. So never mix infectious waste into a non-infectious waste. Never mix chlorinated waste with such waste, those which have disintegrated for incineration. Because once you put some chlorinated amount in a bag, then you cannot incinerate it. So never mix chlorine into incinerated amount. Never overfill or store the waste beyond 48 hours. Because that is not a correct method. You cannot store the waste beyond 48 hours. There should not be any spillage on the way of transport, that we have to ensure whatever the waste we have filled is not spilling off. Otherwise, while transporting, the spillage will be there on the floor and somebody is walking on the floor, will have infection. Maintain the complete record of the biomedical waste. This is more important. So with this, we are towards the end of biomedical waste disposal. We have taken few references as well. And thank you very much for your peaceful listening to it. I hope many of you are here to understand the biomedical waste management rules. If somebody has any question, it is welcome. I hope you have already written the question. So we will see that somebody want to ask the question, they can also ask.
So guys, if there are any questions, please put your questions here, or you can also raise your hand. Okay, so on behalf of NMTA and the entire organizing team, I extend heartfelt thanks to Dr. Pragnesh J sir for sharing such a detailed and practical perspective on biomedical waste management. I would like to thank to our founder and coordinator, Dr. Arvind Singh Panwar sir, whose vision of creating NMTA brought us together today. And thanks to all our enthusiastic participants for making the session interactive and successful. Wishing you all a peaceful and productive weekend ahead. Thank you, everyone.